Hey guys, welcome back to Barry Mulch channel. Today we're going to talk about the side effects of weight loss surgery. Okay, so with any surgery there are risks, there's side effects, there are things that can happen, but I wanted to talk specifically today about weight loss surgery and the things that can potentially happen after you have the procedure. So when you have any procedure, you're gonna have a risk of different infections or different side effects that can happen. So we're not gonna focus so much on those other than the one that you need to look out for the most after surgery, which is blood clots. That's something that is really important that you get up and walk because you don't want blood clots to happen. You also need to look out for leaks because your body is different now. Your stomach, you have a pouch, you have a different way it's cut. You have, maybe even with bypass, you have a different route with your intestines. And when they create those, you have to look out for leaks and make sure that they have properly healed and that they are properly held together the way they should be. So those are kind of the things that you first have to worry about with side effects. But what we're going to talk about is more the long-term side effects after weight loss surgery. The first one that you have probably heard about plenty of times, I know I've talked about it plenty of times, and that is dumping syndrome. Dumping syndrome is something that is very uncomfortable, and a lot of people like to say that it's only gastric bypass patients that have it, but it's not, because I have gastric sleeve and I experience dumping syndrome. What it is pretty much where your body just cannot tolerate the sugar that you've consumed and your body just freaks out. For me personally, what happens is I get really dizzy, I feel really nauseous, and I just start shaking and sweating and my heart starts pounding. It's a crazy feeling. If you haven't gone through it, you don't know until you experience it. Some people have even said well, will I know if I'm having dumping syndrome? And I'm like, girl, yes. You'll know when you're having dumping syndrome because it's just really tough. So the things you can do to avoid that are to make sure you're not eating too much sugar. Sugar is what gives you dumping syndrome, and it's when you consume too much of it at a certain amount of time, it can cause that to happen. The next thing is low blood sugar. So this is something I also experience, and it's very hard sometimes because, especially in the morning, if I have not eaten breakfast, then I start getting crazy low blood sugar. I will start shaking. I'll start just feeling really cold. My body just doesn't feel right. And I learned that I had low blood sugar when I was pregnant because it kept dropping and I would just start feeling really sick. I felt like I was gonna pass out, and I had to start keeping track of my blood sugar levels. And so I had to prick myself every day and see where it was at. And no surprise that when I was feeling really bad, I had low blood sugar. So this is something you need to look out for after having a procedure like this because it is quite common that you could have low blood sugar. This is another thing that people have probably told you, and it's probably not news to you, but malnutrition. Because we cannot consume as much food, we aren't getting the proper amount of nutrition. And with gastric bypass specifically, it works by not absorbing as much. So with the sleeve, it's just the restriction, but with gastric bypass, you have the restriction and the malabsorption. Am I saying that right? I think I'm saying it right. So when both of those are in action, you can have malnutrition. And even with the sleeve, you can have malnutrition because, again, you aren't eating the proper amount of food that you used to be eating. You're eating such small portions. Vomiting is something that can also happen because if you feel too full, you might throw up. This just happened to me actually the other day where I felt like I had something stuck. And you might hear people talk about that, like they feel something stuck in their throat. It was because I ate too much and I felt like it was stuck and I felt like I needed to throw up. This video is kind of disgusting. Sorry about that. Other things that can happen are things like ulcers and hernias. You can have tummy issues. Cannot believe I just said tummy, but that's what happens when you have a 3-year-old, you have tummy issues. And pretty much, different foods are gonna hit you in different ways. And something that you might be able to have eaten before surgery might not sit well on your new stomach after the procedure. So you just have to look out for that because there are some things that are gonna cause you to just have some really uncomfortable tummy issues. Gallstones are another thing that can happen as a side effect from weight loss surgery. And this is because of the drastic weight loss. I didn't have to deal with this because I actually had my gallbladder removed prior to surgery. But you should look out for gallstones because it is something that I hear happens after weight loss surgery. And lastly, the last side effect that I want to share with you guys is constipation. I know I mentioned the tummy issues. This kind of goes with that, the constipation, because since you're not eating that much, you're not eating like high fiber foods a lot, it can cause constipation. So that's something that unfortunately you have to deal with after surgery. So those are the side effects that I wanted to bring your attention to. And if you are watching this and you've had the procedure done, leave it down below and let us know what side effects you're dealing with. Because it just helps people when they're preparing for surgery and they're thinking about doing it. It just kind of helps them see if it's something they can deal with, because it is a very, very different surgery. Your body's going to be different after this. Things are going to change, and the way that you do your everyday life can be different after this surgery because there's just so many side effects can happen. But I will tell you this, that all of the side effects that I've experienced, I would still not change this for anything. I am so thankful I had the surgery. It has changed my life completely. It has allowed me to get healthy, and I'm so happy I did it. Don't let the side effects scare you, because life does get easier. It's a little bit of a shock at first when you start having these side effects, but the farther out you get, the more comfortable you get with these side effects, the more ways you learn how to deal with them, and hopefully some of them go away. So that's all I have for you today, guys. Thank you so much for watching, and I'll see you in my next video. Bye, y'all.